How to identify 11 common dog sickness symptoms. Dogs can't communicate their feelings. As any dog owner knows, a dog's body language says a lot. Dogs hide early sickness symptoms. Because you know your dog, you may notice small changes in their behavior. These changes seem suspicious. If you act quickly, your dog will heal faster. Here are 11 signs your dog needs a vet. 11 signs your dog is sick. Constant diarrhea. Most dogs' first symptoms are vomiting and diarrhea, so these are the main reasons people take them to the vet. It could be fatal or mild. An abrupt change in nutrition, a foray into the trash, a virus or bacteria infection, motion sickness, parvovirus in pups, or a foreign body ingestion might cause these symptoms. If your dog had an upset stomach before and is doing well now, watch for a return. A bland, wet diet such as boiling chicken or hamburger with rice can be eaten in tiny amounts for the first day or two until symptoms decrease. After your dog stops vomiting and has regular bowel movements, switch to dry food. But if your pet has these symptoms more than once in 24 hours, especially if they are accompanied by lethargy, a lack of appetite, or dry heaving, visit your vet. Unusual urination. Potty-trained dogs won't urinate inappropriately. Note these signs. Urinate but can't. Urination changes, and increase or decrease. Bloody urine. Geriatric dogs must be monitored for these symptoms. Diabetes or renal disease may generate excessive urine. Urinary tract infections, bladder stones, blood disorders, and cancer all cause bloody urine. If your dog strains, bleeds, or has chronic urine issues, make a vet visit. If feasible, collect urine. Failure to appreciate dogs, like humans, have different eating habits and may eat more on certain days. A loss of appetite may indicate health difficulties. They range from mild to deadly. Anorexia with bad breath may indicate a dental illness. A little piece of cooked chicken or hamburger or your dog's favorite treat may work. If the symptoms last more than a day or include weakness, lethargy, or vomiting, take your pet to the vet. Drinking change. A dog's irregular water intake or excretion may suggest disease. Minimal water intake may indicate illness, whereas excessive drinking may indicate fever, hormonal imbalance, diabetes, or kidney disease. Watch your pet's water intake. If they are drinking less water, add chicken broth or more bowls. Check to see if drinking increases urine production. If the issue persists, obtain a urine sample and visit the vet. Abnormal weight gain or loss. Abrupt weight loss or growth may suggest a health issue. This signal may take weeks to appear. Sudden weight changes, whether up or down, could indicate a medical problem. Assessing your dog helps identify the cause. Personality changes. Injured or unwell dogs can exhibit lethargy or decreased activity. Even gregarious dogs may withdraw when sick. A pleasant, active pet might become aggressive. Note if your dog growls when you approach a body part. Some sick dogs behave well. Some pets are clingy. Some cognitively impaired canines just act differently. Some signs include your dog not eating, having a stomachache, vomiting, having diarrhea, limping, or straining to urinate. See a vet if your dog's behavior or symptoms change. Coughing, wheezing, and shortness of breath may indicate respiratory distress. Coughing, wheezing, breathlessness, and nasal discharge are respiratory symptoms. These symptoms might range from a cold to canine influenza, kennel cough, or heart failure. Tracheal collapse, a honking disorder, affects several small dog breeds. If your dog has problems breathing or has a bluish tongue or gums, this is an emergency. If an occasional cough persists or is accompanied by other symptoms, get medical treatment. Treat any sudden health change in your dog. Itching, alopecia. Skin infections, parasites, and allergies can cause alopecia and severe itching. This may cause extreme discomfort. Check for fleas, flea filth, which resembles freshly ground pepper, redness, discharge, swelling, discomfort, and a peculiar odor on your dog's skin. Animals with serious symptoms should see a vet. Lameness, stiffness, difficulty increasing. Arthritis, hip dysplasia, joint issues, infections like Lyme disease, and broken bones can cause trouble walking or a limp. If your pet is limping or stiff, minimize their activity. Your dog may be good to rest for the day, depending on the severity of the illness and whether their behavior has changed. If you're worried, see a vet. Eye variations. Red, runny, irritable, or closed eyes may indicate a mild infection, ulceration, or glaucoma. Contact your vet once your dog stops pawing or rubbing its eyes. Rubbing the eye could be dangerous. Your vet may recommend an electronic collar in addition to medication. Pale gums. The tissue behind the lip shows your dog's gum color. Healthy dogs have pink, moist gums. Anemic and traumatized dogs have pale gums. All possible causes are serious. Pale gums, lethargy, weakness, and difficulty breathing may indicate a medical issue in your dog. Call your vet or a veterinary emergency clinic if your pet needs immediate medical attention. Sick dog vet visit. Pets won't come to you when they're sick. Pet owners must monitor their dogs for signs of disease. To remove any health concerns, take your dog to the vet if he has any of these signs. Your vet may test your dog's history. Your dog's medical history. Your vet may request canine medical history, including surgeries and current medications. How sick your dog is. The symptoms' onset, frequency, and other findings are important. Vet insurance for Fido emergency vet visits average $800 minus $1,500. Canine health insurance is a no-brainer when you consider the cost of checkups, testing, and treatments. What's included? Dog insurance covers exams, urgent treatment, routine care, surgery, and expert visits. U.S. and Canadian licensed veterinarians are free. If your insurance covers wellness plans, they may include exams, immunizations, flea, tick, and heartworm disease prevention, and dental cleanings. Check your dog's temperature, heart, lungs, and body for changes. This information may help your vet diagnose and treat the issue. Blood work. CBCs, biochemical profiles, thyroid levels, heartworm testing, and more are examples. This data helps diagnose infections, anemia, kidney disease, hepatitis, and diabetes. X-rays can detect bone breakage, heart failure, and malignancy.